Nepotism has always played an uncomfortable role in American politics, but few moments illustrate its danger more starkly than Robert F. Kennedy Jr.'s rise into one of the most powerful health positions in the federal government. His Senate appearance this week exposed not only his lack of qualifications, but also the deep risks of placing fame above expertise in matters of life and death. The Kennedy legacy and the original Nepo baby. The Kennedy name has carried immense weight in American politics for generations. In 1961, Robert F. Kennedy, just 35 years old, inexperienced as a lawyer, and never once having argued in court, was appointed Attorney General of the United States by his brother, President John F. Kennedy. At the time, nepotism was a normalized practice. His confirmation sailed through the Senate Judiciary Committee with bipartisan support, despite objections from one Republican senator who noted his lack of legal experience. Though Robert Kennedy earned his position through family ties, he grew into the role, developed as a legislator and later as a U.S. Senator from New York, sought to challenge the Vietnam War and fight for justice. His assassination in 1968 cut short a career that had, despite its nepotistic beginning, evolved into one of substance. Robert F. Kennedy Jr., however, stands in sharp contrast. A career built on inheritance, not expertise. Unlike his father, Robert Kennedy Jr. has never been a serious student or practitioner of government. His record is marred by long struggles with drug addiction, repeated failures, and jobs handed to him by family friends. He failed the bar exam while working as an assistant district attorney in Manhattan, a position he received through personal connections rather than merit. He has no background in science, medicine, or public health. Not a single pre-medical course in college. Yet he now occupies the position of Secretary of Health and Human Services under Donald Trump, wielding influence over Medicare, Medicaid, and the nation's entire healthcare apparatus. His appointment was not about qualifications, it was about one word: Kennedy. Trump's nepotism and the war on expertise. Donald Trump himself is a product of nepotism, inheriting wealth, business, and fame from his father. As president, Trump repeatedly dismissed experts, often replacing them with loyalists who lacked credentials but had name recognition or political value. Robert Kennedy Jr. fits perfectly into that pattern, a man placed at the helm of public health not for knowledge, but for brand value. Trump, dazzled by the Kennedy mystique, handed the health portfolio to someone who has spent decades attacking vaccines, spreading misinformation, and undermining medical science. The Senate hearing, lies without oath. This week, Kennedy Jr. appeared before the Senate Finance Committee. Democrats pushed to have him sworn in under oath, a standard measure for accountability, but Republican Chairman Mike Crapo refused. The result was a performance where Kennedy denied knowledge of widely reported events, contradicted his own past statements, and continued to muddy public understanding of health. At one point, he denied knowing about women protesting on the steps of the Capitol the previous day regarding the Epstein files, a claim so blatantly false it underscored his willingness to lie openly. His testimony also revealed his contradictions, calling COVID-19 vaccines a crime against humanity in the past, while in the same breath supporting a Republican senator's claim that Donald Trump deserves a Nobel Prize for overseeing vaccine development. Dangerous consequences, lives at risk. Kennedy's anti-vaccine crusade has already had deadly consequences. Measles outbreaks have returned to the United States for the first time in decades, fueled by declining vaccination rates linked to misinformation campaigns. Doctors and senators at the hearing directly accused him of being a hazard to public health, warning that his rhetoric has emboldened extremists and undermined trust in science. The stakes are high. The Secretary of Health and Human Services is not a ceremonial role. It directly impacts healthcare policy, disease prevention, and medical research. Placing an unqualified conspiracy theorist in charge threatens the safety of millions. Nepotism, then and now, a stark contrast. Nepotism in American politics is nothing new, but the difference between Robert F. Kennedy Sr. and Robert F. Kennedy Jr. is profound. The elder Kennedy grew into his role and worked toward justice. His son, however, has used the Kennedy name not to build but to destroy, not to guide but to mislead. And unlike the 1960s, when nepotism was largely tolerated, today its consequences can ripple across global health systems in real time. In an era of pandemics, misinformation spreads as fast as disease, and Robert Kennedy Jr. has chosen to weaponize both. Conclusion. What the Senate hearing revealed is not simply a lack of qualifications. It revealed entitlement, audacity, and the belief that a famous name grants the right to mislead the public. Donald Trump and Robert Kennedy Jr. have built a dangerous partnership, one rooted in nepotism and attention-seeking at the cost of public health. When lives are at stake, expertise is not optional. America is paying the price for confusing fame with competence.